I am going to be doing just an overview of SHIP evaluation. As you can imagine, evaluation is a very big topic. And so we could spend hours talking about evaluation, program management, et cetera, but we're not. Just consider this as like a primer to evaluation. Some of you have heard some of our presentations before, some of you are new. So for example, I just recently met Wanda. Welcome, Wanda, from Iowa. I'm sure there are others of you who are on today who are also new, and it's great to have you. So this is just a primer. One thing to note is Matt had mentioned just some of the responsibilities of the center, and the center has a lot of evaluation materials on their website. So when you're done listening today, if you have questions, if you're looking for more information or resources, I highly recommend connecting with either the center staff, going to their website. I will have a link on the slides that you'll have access to, so you can find some of their information there. You can also go to the Rural Health Information Hub. There's evaluation information there. And then this is going to be a somewhat interactive session. So as we're talking and hopefully getting some comments from all of you, you're going to see names pop up in the chat box. And that's an opportunity to see what other states are doing with their programs, maybe even see somebody that, hey, I want to reach out to them. See that as an opportunity as well. But always know that you can connect back with the center if you have questions, you're looking for more information about evaluation and program management in general. All right. So what are we going to cover today? Depending on time, hopefully we will get through an evaluation overview for sure. And then I'm going to walk through the evaluation process. I've actually done an extended evaluation process for us, and I've extended it based on working with a number of SHIP programs around the country, learning kind of what's going on in our programs, who's doing what are some of our needs, and what are some of our challenges. So I've broken it out a little bit broader than what we've talked about in the past. Just to really dig into a couple of key areas that might be particularly helpful for those of you who are new into the program. So we're going to get started. I'm going to start with the evaluation overview, and then we'll go into the process itself. So just from an overview standpoint, one of the things that we often hear from a program standpoint is we hear a couple of different concepts. One, we hear performance measurement and performance management, and then we also hear about evaluation, the need to evaluate, program evaluations, et cetera. And so when I'm talking to SHIP programs or flex programs, a common question I get is kind of, what's the difference? What do I need to be worried about? How should I see these? How are these different, et cetera? They are a bit different. And they're different in terms of performance management and measurement really focuses on reporting back out and telling about your program. And evaluation is more about your fine-tuning your programs, looking at impacts, looking at the desired results, and being able to report that out as well. However, with that said, one of the things that we aren't going to be doing as a part of our discussion today, or even that we don't do within the SHIP program, and I'm going to say flex too, since I know a lot of you work on flex, is we don't really get into the weeds between performance measurement and management and evaluation, because most of the time we're doing a combination of both. So as I'm talking today, I'm not going to get into the weeds of both of these. We're going to really blend the two of them so that it doesn't get overly complicated, and so that we can really be thinking about being able to do both of them at the same time. And I think that that's really, really important because we all have limited time. We all have limited resources. Most of us are not, in a position where we can be collecting hordes of data, analyzing it, slicing and dicing it, et cetera. The vast majority of our programs are run by one individual, sometimes one individual that's running multiple programs. So we really have to be realistic about what we can do and what we can report out and how we can really be working on both evaluation and program management and improvement at the same time. The other thing that's really positive about blending those two is we can be using the same data to be doing both without getting overwhelmed. So just keep that in your back pocket. This isn't going to be a university session of any sort where we're in some high level analytics course. That is not the intent. Okay, before we move too far forward, I would like to take a step back for 1 second and do a couple of polls. Matt, can you put up both of the polls?
Yes, and we are actually going to add our poll with the 2 questions at the beginning that we didn't do at the beginning along with yours. So Robbie will jump those up. So we have about 4 poll questions here if you guys want to jump in. If you weren't paying attention, now would be the time to do that and click a button.
Awesome. So your polls are the first 2 kind of knowledge about SHIP evaluation and grant management. And then the 2 polls that I am looking for information on are, do you have performance management or evaluation built into your SHIP program already? Really helpful to know in terms of kind of where I'm going to focus today. And then the second question is, what are your biggest challenges of building performance management and evaluation into your SHIP program? So do you have it built in? And then what are your greatest challenges in terms of building evaluation and program management into your program? All right, so it looks like half of you have it built into your SHIP. Awesome, way to go. 16% no and 34% of you unsure. Let's see, biggest challenges. 16% not sure how to get started. 16% not sure what to do. Lack of time. Lack of measures or measurement. Access to data for measures or measurement. Low priority because data findings aren't used. Contractors do most of the activities, so it's hard to know, hard to engage SHIP hospitals in reporting data and information. That looks like that's the greatest issue. For the others, if you want to put in the chat box what those other issues are, that would be really, really helpful. Not only can I use this today as we're kind of walking through the slides that I've put together, but the center team, the center team can also use this as they tailor some of their programming and think of how best to support you all as well. All right. So as we've stepped back and as we kind of think about evaluation and even those questions that you all just responded to, I think the first question that's really important as we kind of build our program, we think about what we're doing and kind of why we're doing this is, why do we conduct program evaluations? So I'm going to open up the chat box here for everybody. If you want to just put comments in there, why are we conducting program evaluations? You can specifically to the SHIP program if you want, if it's just general. Feel free to just type in why we are conducting program evaluations. Everybody just chime in. I'll give you a couple of seconds to respond. See, Aaliyah put in a comment about issues with evaluation. Thanks, Nick. Nick says we conduct evaluations to see if it's working, how effective are the interventions and projects. Exactly. Lynette, to evaluate program efficacy. Lindy says to assure that our hospitals understand the activity that they're selected, as well as make sure they are on track with completion. Awesome. Rachel, to to determine the overall impact and benefit of the program on the ship hospitals, to see what best course of action to take. Awesome. Wanda, we conduct evaluation to gather information about how effective our programs are. Quinata, to ensure that the programs are having an impact and to pivot as needed. Evaluations are worthwhile because it shows that grants are needed. Assess the impact on grant investments. Decide how to drive future funding choices in addition to those above. Awesome. Exactly. All of those are correct. All of those are reasons why we conduct program evaluations. So we conduct them to understand and increase the impact of our program and activities, efficiency and effectiveness, validate program and activity intents, enhance program reporting, support program planning, development, management, and implementation, encourage ongoing program revisions, improve engagement, and to use our federal funds wisely. All of those were represented in comments that you all stated. So very similarly, when we ask ourselves, why should we evaluate our state ships? It is for the same reason. All program evaluations really kind of boil down to wanting to accomplish the same outcomes in terms of looking at what we're doing, what are we making the improvements, etc. As you think about all of this and the purpose of your ship evaluation, that purpose of what you're trying to accomplish is going to guide and drive how you're building your evaluation work into your program activities. So as we move through this discussion, really keep this purpose in mind, because all of that is going to be the backdrop of what we decide we're going to do as a part of our evaluation activities. So I'm going to just pause there for 2 seconds, see if you have any questions about the purpose before we step into the evaluation process. Any questions about the purpose before we step into process? All right, I don't see any. And also, Matt, if you can keep your eye on the chat too for me, just in case if questions do come up, that's always really helpful as well.
I certainly will.
Thank you. All right, so we're going to get into the process. So the process, I have multiple steps here that we're going to walk through. We're going to spend some more time on some of the steps than others. Some of the steps actually take quite a bit of time to really work through and develop some good skills at being able to do them. But I do think a couple of our first few steps are critical if we're going to be developing our programs and really understanding how we can be making improvements and best serving our customers or the hospitals. And as I noted earlier, one of the things I really thought about in terms of putting this together were conversations that I've had with SHIP programs over the last couple of years. And I really do think the very first step of building your program and really thinking about how we're going to build an evaluation into it is to know your SHIP. Now, some of you are new, and so this is, you're right at the beginning stages of understanding what your program is about, what some of the activities have been in the past. And then others of you have been doing SHIP for a while. Some of you have been engaged in some contracts for a long time. Others of you have been building on new program activities over time, so your SHIP program may have changed. But really knowing who's involved in your SHIP program, whether it's the contractors, the hospitals, any of your SHIP team members, there are different people in your hospital or within your office that can play a really big role in SHIP from an evaluation standpoint, in particular your Flex program team members, because some of the data that they're gathering for their program activities can apply to what you're doing on the SHIP side as well. Knowing what activities you're doing, knowing why you're doing the different activities that you're doing as a part of your program, knowing what that timeline looks like, and then knowing where all of these activities are happening, whether it's in hospitals, as a part of workshops, through vendors, all of that is going to be really important. Not only will you use this in terms of um, laying out the objectives that you've got as a part of your program, but it's also going to determine what some of those measures are that we're going to talk about, but then also some of your data collection opportunities. And all of that goes back to knowing your SHIP program. The next step would be really to know your stakeholders' needs and then to engage your stakeholders in understanding those needs better. Some of you have been making quite a bit of changes in terms of gathering information about your stakeholders' needs. And a really good example of this is through the grant. When you ask your hospitals what they're going to be using funding for and how they're going to be using that funding. So for example, some of our SHIP programs have built in some of this knowing stakeholder needs and engaging stakeholder needs into that application process by maybe putting the application online, asking extra questions about their application to get information that way. Really understanding how are the hospitals wanting to use the funding, but then also what are they hoping to accomplish through the funding. Other opportunities or places where some of our SHIP programs are getting to know stakeholders' needs and engaging them is through site visits. When you go out and do a site visit, or you have a workshop, or you have any type of meeting, etc. Again, another place where you can have a conversation to find out what are their needs and how are they going to be using this funding to advance those needs. All of that information can really help you set up your program from a plan standpoint, but also determine what you're going to build into your program evaluation, because you know what they want to do, what they want to accomplish, and in that process, how they're going to actually get there. So really having those conversations and engaging them on the front end can be really helpful in evaluation as well. The next step that I have is to identify what your evaluation priorities are. I know that in the poll, a number of you indicated it's just the getting started piece, knowing what to do, how to do it, etc. A really important thing about evaluation in general is that when you're just starting to build your evaluation and you are wanting to build evaluation activities into your program, you don't have to do everything from the get-go. You can start to build evaluation activities into your program as you go along and as you get better at building the evaluation, as you learn more, as you get to know your stakeholders more, as you learn about what data is available and how you can collect that data a little bit more easily. So really from a getting started standpoint, it's really about just starting someplace. And you may decide that you want to just start with a specific goal and really focus there. It may be a specific objective. It may be a part of your program where you're investing the most amount of resources. It could be a place that your program wants to get some additional knowledge, or an area where you're going to be moving more into the future. And so you want to be able to develop that program area even better. So keep that in mind as we kind of move through each one of these steps, that you don't have to be evaluating your whole program right out of the gate. You can build program evaluations into your program over time. And there are lots of different questions that you can consider as you're trying to figure out what are those priorities. So, like I said, it could be where the investment is going to be the highest. Is it where the most number of CHs or ship hospitals are going to get impacted? Is there some kind of strategic value for the program? Any kind of any type of program administration pieces that might be a priority for you or your program. All right, so those are all the foundational pieces of your evaluation and kind of program management process. The next set of steps that we're going to talk about are really about putting that evaluation into place and beginning to build the components into your program so that you can start understanding what's going on with your program. You can identify what those objectives are, and so you can start to think about what do we know about our program, what's working, what's not working, and where should we be making some changes or making some tweaks to the program so that we can improve it. So step 4 then would be to set our goals and objectives. Basically, this step is all about where do you want to go and how do you know if you've gotten or are getting there. These are the two areas, setting goals and objectives, that will, by knowing, by having a response to whether we've met our goals or objectives, that's where we start knowing about if we've gotten there or if we're getting there. One thing to note about setting goals is that for most of the programs that we're implementing, um, the goals have, many of the goals have been set for us, or they're at least loosely set for us. And they're namely set by within the programs themselves and through the Federal Office of Rural Health Policy when they set these programs out and they release all of the program materials. But for any of these, I have on the right-hand side just a list of some very common goals that are a part of the SHIP program that most, if not all of you, have built into your SHIP programs already. The important thing about goals is that goals always provide some kind of a direction where we want to go. We're either improving, increasing, we're moving in some direction. In some instances, it could be decreasing. Oftentimes it's on the improvement side, but there are areas where we would be aiming to decrease something. The other thing that I should note about goals is if you're looking across programs, some of our SHIP programs actually create SMART goals. I'm not going to talk specifically about SMART goals, but I am going to talk about SMART objectives. So for some of our programs, and as you move forward, you may decide that you want to create some SMART goals for yourselves. And I'm saying this for some of our more, our programs that are much further down the line with their evaluations and in their SHIP programs. SMART goals might start to make sense to you and might start working for you so you can further define what you're doing. But for the vast majority of our SHIP programs, we're really sticking with the goals that the Federal Office of Rural Health Policy has set out for us. All right, so I didn't spend a ton of time on the goals because, as I said, a lot of our goals are set by the federal office and most of us are using those. I am going to spend a little bit of time on the objectives piece because for any one of you that have worked with me, I really spend a lot of time on the objective side and in looking at work plans and working through work plans. This is my own bias, but I do think that the objective side is the most important piece in building an evaluation and in helping us determine whether we've met what we've set out to do or whether we haven't or whether we've gotten partway there, etc. And the objectives are really, really important because they have to be really well defined if they're going to be useful. And most of you who've been around for a while have heard about SMART objectives. And there is a real purpose to this, and it's because if they are smart, then we can build measures that actually will determine whether we've met our objectives or not. If we don't have SMART objectives, then our objectives are so loosely defined that it's very difficult to create measures that will actually get us to the place of deciding, did we meet it or did we not meet it? So spending time on developing um, objectives is SMART objectives is a really important piece of developing your evaluation and building it right into your SHIP program activities. So what are SMART objectives? SMART objectives are very specific. They have to be well-defined and focused. And I'm going to give you some examples of these so you can actually see what I'm talking about. They have to be measurable. There has to be something that's quantifiable if it is SMART. If it's not quantifiable, then it is not SMART. It really should be attainable, something that is realistic. It could be based on national standards or trends, but it really should be attainable. It should also be relevant. It should align with what you have established as your values and goals for your program, and then it should be time sensitive. It could be based on a certain date, it could be within the grant year, it could be based on certain priorities, or it could even be based on something that's going to motivate you or your SHIP hospitals in terms of making movement within that objective. So having building this kind of SMART logic into your objectives is going to be really, really critical when you're thinking about putting together your evaluation plan and really building it into your program activities. Before I move on a little bit further, I do want to pause here just for a second. I know some of you have been hearing about SMART objectives forever. Some of you are new. Any questions about just kind of this whole kind of SMART philosophy before I move on to some examples and talk a little bit more about these? All right, and remember to use your chat, the chat box too, if you have questions. So here are some examples of some SHIP objectives that are not SMART and SMART. The ones that are not SMART, these are actual objectives that exist out there. And then the SMART objectives are kind of revisions of the not SMART versions on the left-hand side. And you can see some considerable differences between the not SMART and the SMART. So for example, I'll just walk through a couple of them to give you an example as to why having a SMART objective is really helpful. So for example, the first one is conduct effective SHIP administration. And it's not that we don't want to have effective SHIP administration as a part of our SHIP programs, but that statement doesn't give us any language or context in terms of deciding whether something was effective or not. So instead, we need to really define what we mean by effective administration in order to determine whether we've been effective or not. And so, for example, if we turn that concept into something that is SMART, but it's really defined, it's within 2 weeks of receiving the notice of grant award. The State Office of Rural Health distributes the NGA and contracts to whatever recipients hospitals. So really having a timeline saying specifically what we're going to do gives us something that we can actually measure. Did we do it within 2 weeks? Did we get it out to all of the hospitals? Did we do it as we stated that we were going to do? So really defining this well so that we can measure it is going to be the critical piece in terms of turning any of our objectives into SMART objectives. Another example that I could put on here or that I could walk through is the provide training to support hospitals in meeting ICD-10 requirements. Yes, we want to provide training and we want it to be ICD-10 related, but it doesn't, there's nothing there to indicate whether we accomplished, to who, to when, any of those things. We can't measure anything that's in that statement. However, if we turn that and we write something like within 2 years of SHIP funding, all hospitals participating in the SHIP ICD-10 cohort have at least 3 team members trained in ICD-10. Now we have something that we can actually measure. And so it's really turning any of those statements of what we want to accomplish into something that is measurable and time sensitive, so we know if we've done it within the time period that we've specified. Any questions about turning those statements into SMART objectives? And I did have a comment in the chat about the slides, and yes, these slides and the recording will be available after today. Any comment about the changing an objective from a statement to a SMART objective? The key with making these objectives SMART is really to sit down with your work plan, to come up with your priorities in terms of what you're going to evaluate, and then walking through all of your objectives that you have and that you're going to focus on, and really making sure that they're SMART. If they're not SMART, then it comes down to walking through each one of them and looking at how can you make them quantifiable, time sensitive, etc. As you work through them and as you get more practice at doing it, it'll definitely be easier. I know it takes a lot of time to do it, and when I've been working with SHIP programs, honestly, we spend hours and hours translating statements into SMART objectives. And but as we do it together and as we practice it and as we start putting work plans together, we definitely have a lot of aha moments, and you really just start seeing the whole team get into a pace where it's like, oh yeah, no, that's not SMART. All right, well, this is what we really want to do. It's also a great opportunity for you to be looking at what you think you want to do and then to rethink it, think, oh, is that really what we want to do? Is that really what we're trying to accomplish? And then as a team, you can walk through those. The other thing that I've seen in terms of this, the SHIP objectives, that's been really cool over the last couple of years is oftentimes we have programs where the SHIP objectives are the same as the flex objectives. And so it's a great opportunity to have them either the same or one could be an advancement of the other, and you're using the same data and you're sharing the same data that you can use just to determine did we meet that objective or not. So you don't have to always be creating new objectives. You can often complement objectives throughout your programs or even have some of the same objectives because you're trying to leverage the resources of both programs in order to do some of the same things. So keep that in mind as you're building your evaluation, as you work together as a team within your State Office of Rural Health. All right. After you've created objectives, then the next step is going to create the measures. The measures are how you're going to be really thinking about your data and how you're going to be measuring and determining whether you were able to reach those objectives that you set. Um, in creating measures, you will very often have multiple measures for one objective. So there's different components that are different type of data that you need to collect for each one of those objectives. And so you're going to have different measures in order to get there. It's very similar to objectives that then build up to whether you accomplished your goals. You will have many objectives that will determine whether you actually accomplished your goals as well. So this is really just building blocks um, that that are built on one another in order to determine whether you had the impact that you set out to do. There are different types of measures, and it can get kind of complicated just because that's just, you know, the way it is in terms of thinking about our programs. Our programs are complicated. They're pretty complex. There's a lot of things going into them, a lot of work that you're doing every day to make them happen. I'm just going to briefly go through the different types of measurement, and then I'll have some examples that I think will kind of show what each one of these look like. But you can always refer back to these. I also recommend for any of the measures, this measures section, to go and look at some of the evaluation um, videos that the center has on their website, because they have some more in-depth information about all of the about measures and measure identification, etc. But there are four kind of basic measures that we talk about the most, and then there's one other measure, which is an impact measurement. I'm going to spend most of my time talking about the input, process, output, and outcome measures, since that's where we spend the bulk of our time. As you get further along, again, in evaluation, you'll be moving further into impact, which is much broader and bigger. But input measures uh, are what's going into your program in order to make it happen. So it's the staff that's going into it, any financial contributions, resources, tools, data, all of the inputs that are making that program happen. The process measures are all about time, your systems. Um, when you think about your program, it's the processes that you have in place in order to make things happen. A lot of our SHIP programs are measuring process right now. If, for example, they have a real challenging time with their contracting process. So it's very hard to get contracts in and get contracts out. Um, some of our programs are using process measures because they are having a hard time getting the grant applications back from their SHIP hospitals, and they're really trying to improve that process related to the grants administration and getting applications back, and then also getting data back from their SHIP hospitals. Output measures are more about the products and services that we are delivering. So the workshops that are conducted, you know, how many workshops, how many projects are done, how many staff are being trained, how many webinars are occurring. Um, just all of those kind of bean counting measures are considered to be outcomes. And then our outcome measures are all about change. So what kind of change is taking place in our HCAP scores? What type of change is taking place in terms of ICD-10 improvement? What kind of change is taking place in terms of adoption of something new within our SHIP hospitals? Anything that really results in change is going to be put under that category of output measures. And then finally, there are impact measures. These are broader, they're longer term. really look at kind of programmatic change, population and community change. So changes in population health, changes in access, changes in quality of care across the board, not within one bucket, really changing in terms of having an impact that's broader. That would be an impact. All right, so what I've done here in this slide is to really take all of these different areas that I just have been talking about, from goals to objectives to measures, and laid them out for you so you can kind of see how they're built upon one another. So first we have our goal, the high level, moving in a direction, advancing the development, and then each one of the objectives, which are laid out below that, and then a list of activities which lead up to our objectives. And then on the far right hand side, you see a column of output measures, process measures, outcome measures, and impact measures, all of which tie back to this list of objectives and the different activities that we have built into this kind of, I'll call it fake SHIP program. It probably reflects one of your SHIP programs in some way, but just one of the program activities as far as goal one and what it might look like. I'll give you just a couple of seconds to look through that and ask any questions if you have any. I'm not going to walk through each one of these just for time purposes, but I thought it would be helpful to be able to look at everything put together, and then you can refer back to these and also ask any questions if you have any questions.
And to Nick's comment in the chat box, that is a problem that everyone has, I think, from time to time, getting outcome and output mixed up. I think it just practice makes perfect, and understanding that there's a difference between the two. So don't beat yourself up too hard on that.
This is Penny. I put a question in the chat box, so I'm feeling ignored.
Oh, Penny.
Penny, I just saw that. Sorry, you're not ignored. We love you and value you. So Penny asks about 64 SHIP hospitals, and each does their own thing. Should she have a separate objective for each hospital? That's a great question.
So Penny, I'd have to know more in terms of they're each doing their own thing. There's only so many goals within the SHIP program. So can you tell us a little bit more?
Yeah, I mean, the comment before that, or the sentence before that, is really kind of the impetus, is that the objective, the examples that you were sharing, they assume that there's a strategic plan laid out for the SHIP program, when it really, if we're being honest, it supports purchases of products, software, training, vendor services, things like that. It's not set up to necessarily lead to long-term change. So I don't know how to say that without throwing ourselves under the bus, but I mean, we've got 64 hospitals who are purchasing 64 different things. They're not doing 64 different improvement projects. So it's hard for me to wrap my head around meaningful objectives. And I know some states are doing fantastic, cool group initiatives with SHIP, so that might lend itself more to those meaningful objectives. But at least my experience with SHIP, it's been each hospital makes a purchase and submits an invoice. And as an evaluator, yes, I want to know more. I want to know, why did they purchase it? And what did they use it for? And what happened? But I think it's unrealistic to expect the activities as they're outlined in the grant to lead to a whole lot of change. So I guess sorry, go ahead.
Yeah, so a couple of ideas in terms of what I've seen some of our, some states do similarly. They may not have all 64 hospitals doing all unique and different things, but a number of states have moved their hospital grant applications online using a survey approach, um, using one of the survey tools, like SurveyMonkey. I think you use Qualtrics. And they are asking some of those questions that you asked as a part of that application process. So they've built in, you can have some conversations with your SHIP hospitals in advance about, okay, get some general ideas about what they're trying to accomplish with this. So you could build in some multiple choice questions in terms of what they're trying to accomplish with it, or have it open-ended. I tend to be not lean very heavy towards open-ended questions because we then don't get responses. But it does depend on your state and your hospitals and whether it's required as a part of the application process. But that is an avenue that some of the states have gone in order to try and beef up their knowledge about what the hospital's trying to accomplish and whether whether they've accomplished that or not.
Thank you.
Yeah, I think the other thing too is the other area, just kind of building on what Penny said, because a lot of our hospitals are using SHIP funding for HCAPS, paying for their HCAPS vendor. And there are, again, a few avenues that some states are moving in. So from a process standpoint, an improvement standpoint, some states are working to wean hospitals off of using that funding for HCAP's vendor uh, payment. And then some are blending or leveraging Flex. So they use the SHIP funding for the HCAPS vendor, and then they are leveraging their Flex program from an improvement standpoint to really work with the CHs on HCAPS improvement at the same time. So yes, we've paid for the vendor, but can we also then make movement forward from an outcome standpoint by advancing some of those HCAPS measures at the same time? And you can do that, and you could even do that within just the context of your SHIP program. But where I've seen it happen more is really leveraging those two pieces together and building that again right into that SHIP hospital grant program application of, okay, you're getting funding. So where do you plan on making improvement now that you are going to have access to this data, for example?
Rochelle, we had two comments in there. One was from Misty saying that she was found that asking questions up front and getting valuable answers is quite difficult with her hospitals. And another from Nick. But co-telling on Penny's point is it only one measure defined per work plan activity? Is that sufficient, or 64 times all chosen activities?
So I'm going to start with the first question. Asking questions up front, getting valuable answers is quite difficult. Yes, definitely something that we hear from folks. And so a couple of things or avenues to go down in terms of seeing if you can get some information so a lot of us do site visits as a part of our program. So when you're doing a site visit, or if you're having any workshops, face-to-face meetings, registrations, etc., think of any of those touch points as an opportunity to get data and information. The other thing is, as I said, by having open-ended questions, we're much more likely not to get answers. So the more you can know, and really like my second kind of point in the evaluation process of the stakeholder buy-in piece is really having engaging your stakeholders on the front end of SHIP and asking them some of those questions so that you can have multiple choice questions and not open-ended. That will definitely help in that regard. The other thing is that with the program, that if is to focus on certain areas where you where you have your priorities from an evaluation standpoint. I'm big into the path of least resistance, and so if you if you have an area where you can start making some headway and gathering some data and really seeing what's happening, and you're able to report some of those outcomes, go that path. Because then once you collect that information, you can start sharing it, you can start using it and promoting it and talking to your other SHIP hospitals about, hey, this is what we're trying to show, this is why we need this information, this is how it can be helpful, and really kind of promote it that way as well. And then Nick, typically one measure defined per work plan activity, it may or may not be one. It really depends on what your work plan looks like and what your objectives and activities look like. So it really depends from one activity to the next. Sorry. Sometimes it can be multiple. However, oftentimes you can use the same data. You're just crunching those numbers in different ways in order to get at some of the measures that you're collecting data on. All right, so we have about 1 minute left. I do have this outcome versus impact slide in here. Look at that. Collecting and analyzing the data. A lot of you talked about challenges with collecting and analyzing the data. In the slides here, I have some examples of where you can consider getting some of that data to help you as a part of your data collection process. But the best place to start in terms of figuring out how you can easily get the data is when you host, if you host a SHIP kind of one-on-one session at the beginning of each one of the grant years, or if you're doing site visits and you're talking to your SHIP hospitals at those times, or as a part of that application that goes out, that's another easy place to be collecting it. And then any of the other places where you're collecting data through your program, where you can just tap in and have collect that data as a part of some of your other data collection mechanisms. But again, you're really going to have to know what your objectives are and what your measures are so that you can fine tune the data that you want to collect. I have a couple samples. These are live samples from some of our SHIP programs that are operational. So here's a couple of samples of some data collection tools that are getting used. You can look at these. And then the last piece is really the reporting findings and making changes as needed based on what you learn. I'm a real supporter of you getting this information out to your hospitals. Once you learn kind of what's going on, what's working, what's not working, sharing those, having SHIP hospitals share with other SHIP hospitals, making program changes when you think that things aren't working. And then again, go back to step one, know your SHIP program, and then begin the process again. I do have a link at the bottom that's for the center's website, so you have that. I have this PDSA cycle on here because as we talk through this should really sound and look a lot like the PDSA cycle that we're doing with quality improvement in our hospitals. It is exactly the same, basically. It's just that we're doing this as a part of our program versus doing this as a part of our quality improvement initiatives or financial and operational improvement initiatives within the hospital. So it's the same concept, just doing it at the program level. All right, sorry about that. We did run out of time, but thank you. I highly recommend you reaching out to the center staff if you have more questions or visiting their website. It has been a pleasure being with all of you today. I hope you all stay well. And thank you so much for joining us.
Yeah, and we're going to put up the, have a few last announcements. Robbie's going to put up the poll right quick, if you wouldn't mind answering that. And here's just a few upcoming reporting requirements. We have one coming up on the 29th, again on the 30th of October, November 30th, and then again, you have the COVID SHIP reporting requirements due on the end of October as well, because there's never enough reporting to do in our jobs. So there's a lot more coming up. We really appreciate you guys taking the time to be with us today. This recording will be made available in the next few days. We'll be make sure to send out an announcement about it. Feel free to check the website. And if you have any other questions about that, please let us know. If you have any questions for Rochelle, you can send it to her directly or to us, and we will be also make sure that we get the slides out for you as well. Rochelle, any parting words for you?
No, that's it. Thanks, everybody. I hope you're all great.
Thank you, guys. Y'all have a great day.